take a functional nutrition approach to your health with this video. Inside this video, I'm going to identify what a root cause approach is and how to heal your issues. PCOS, IBS, IBD, autoimmune conditions, hyperthyroidism, hypothyroidism, PCOS, all these hormonal balances, thyroid imbalances, and gut dysfunctions, weight loss resistance. I'm going to tell you it all. I'm going to explain to you what is a functional nutrition approach and then build upon that. In this video, I want to give it to you all. I want to explain to you what it is all about. So I want to start with what is functional nutrition? What is this functional medicine root cause approach? So functional nutrition is defined as a comprehensive and holistic approach that focuses on addressing the underlying causes of health issues. With functional nutrition, we're looking at the underlying causes to why you don't feel well. We're looking at things like your stress, your sleep, inflammation, toxins in the environment, nutrient deficiencies, genetics, and all of that. And we have to understand, and inside my coaching, we understand that each individual is unique. So their approach to health, their approach to healing should be different than another individual. And we have to understand this. And just like in Western conventional medicine, they just give one medication for everyone, like they're the same person. This is flawed. We need to make a tailored approach, individualized approach to that human being, that person, that individual. And we have to stop thinking of them as another number, another client, and another prescription drug to be written. We have to look at them as they're a person. This is what Minnie's doing. They're failing you. Medical system's failing you. The naturopathic is failing you. Functional medicine doctors are failing you. They're telling you to go get these lab tests done, and then take all these supplements, but they're not actually looking at your emotional self. And this is why we get results. But, before I get too worked up, I want to give you the education here. So there are 4 primary aspects to the root cause approach. There's the underlying cause, which is number 1. What is the underlying cause? We'll get into that. 2 is physiological damage. What is the damage that's inside of you that is causing these problems? 3rd is body systems. Hormones, organs, detoxification, what's going on? And the 4th is the symptoms, and that's the one that you see and feel. Brain fog, fatigue, weight loss resistance, insomnia, low sex drive, PMS, infertility. The list goes on and on. You heard it before. All right. So just like I said, the first aspect to the root cause approach is the underlying cause. Symptoms are visible outcomes. So the primary underlying causes are emotional factors, trauma, chronic stress, and addictive behaviors. The next is dietary stress and dietary factors, food intolerances, nutrient deficiencies, viral infections, blood sugar imbalances, gut bacterial imbalance, fungal imbalance, toxins, exposure to chemicals, heavy metals, mold, sleep, exercise, surgery, and dental hygiene. All these things are the underlying causes to your problems. So here's the thing. You're struggling with an autoimmune condition. Either they're giving you immune suppressant or they're giving you some type of other drug. Maybe it's synthroid, levothyroxine if you're struggling with Hashimoto's. Maybe you're struggling with Graves. You're giving something else. Now, no matter what you're struggling with, chronic fatigue, we have to look at these underlying factors because they influence your body's systems. They influence other hormones and things like that. Next is the physiological damage that's going on with you. Number 1 is chronic inflammation. Systemic inflammation. Inflammation is good, but when inflammation gets prolonged for too long, this is when you get health issues. So if you continue to stay super inflamed, then systems start to downregulate. Inflammation causes gut bacteria issues, so you're going to have IBS, IBD. You're also going to have chronic bloating, constipation, diarrhea, acid reflux, heartburn, indigestion, GERD. You're going to get sex hormone imbalance. You're going to get PCOS, PMS, early perimenopause, menopause, into it earlier. And you're going to get all these issues, and it's because we're not looking at this chronic inflammation state. Same with the next. Number 2 is catabolic. Catabolic is just a smart word to say that your body's breaking down its own tissue, muscle, for energy. So it's eating itself, because back in Paleolithic times, they didn't have food, so their body would have to become catabolic almost so it could stay alive. So that's why your body's set that way. That's why it's like that. Number three is insulin resistance. If this glucose can't get inside the cells for it to be used for energy inside the mitochondria, obviously you can see that array of symptoms and dysfunctions will occur. Hormones won't get made properly, organ systems won't be functioning properly, and the latter. And number four is oxidative stress, which is the number one right now in our nation because, inside my program, we're doing specific detoxification protocols tailored to the individual. But if you aren't doing these things, you get oxidative stress. And this is when you have something called, what's a good way to put this? More so, you have things that are, we'll just skip over that for now. I'm not going to get too much into that. Okay, number three is body systems. You have your gut, your adrenals, hormones, thyroid, and brain and nervous system. Okay, so these are the things that you usually see on the outside. So we just talked about what are the things going on in the inside, and now we're going to get the last two. What are the things going on the outside? So meaning, these are the things that we test. These are the things we look at in blood tests or in stool samples or things like that. So your gut, adrenal, hormones, thyroid, and then brain and nervous system. Now, you don't obviously test all of them, but just some of them. So, and then the last is a symptom, okay? I'm assuming that if you're watching this, your symptoms are weight gain, fatigue, depression, anxiety, gut issues like bloating, constipation, diarrhea. I bet you have low sex drive, PCOS, PMS, irregular cycles. You have pain in some area. You have ADHD of some sort, insomnia, brain fog, sugar cravings, skin issues, and autoimmune flare-ups. If that sounds like you need to take a root cause approach to your healing. Okay? See, we have to look at the problem completely different than just conventional Western medicine. They go treatment, and then they go the diagnosis and then treatment. Okay? High blood pressure medication. Low thyroid hormone, thyroid medication. Hormonal imbalance, birth control. See, this is flawed. It is neglecting how your body is one interconnected system working in unison rather than just isolation. Okay? So we need to address all these factors underlying. We have to address all the factors at its roots. So, and for the sake of this video and the complexity of it, I'm going to break it up into the gastrointestinal system, neuroendocrine system, and detoxification. So majority of the problems today, we'll get the laptop down now. So majority of the problems today that we're seeing in individuals is some type of gut dysfunction. So many people deal with, feelings of bloating, fatigue, and all other types of gut symptoms. So what's usually happening is leaky gut, SIBO, small intestinal bacterial overgrowth, fungal overgrowth, low bacteria actually. So meaning you don't actually have enough good bacteria in your gut, so it's giving you symptoms. And then inflammation. Now, all disease begins in the gut. It's correct. Hippocrates said so. But there was a time when your gut got in that dysfunction, you see? There wasn't that you woke up one day and your gut was a mess. Don't worry, I'm going to get to how you fix all this. I'm just going to go to it right now. We're just getting into the educational part, okay? So we talked about the gastrointestinal system. So all disease begins in the gut. Next is the neuroendocrine system. Now this is very common. So neuroendocrine system is a group of hormones essentially coming from the pituitary gland, the hypothalamus, going to the ovaries or the testes, the thyroid, the adrenals, and all of that, and cortisol. And so the neuroendocrine system plays a huge role in the symptoms that you feel, because if you have high cortisol, then you feel fatigue, sugar cravings. If you have low progesterone as a female, you have PMS, perhaps PCOS, perhaps, and all other types of hormonal issues. And if you have low testosterone as a male, then you obviously have low libido, low sex drive, erectile dysfunction, and all of those symptoms. So no matter what you're experiencing, you have to look at it at a root cause approach. And how do we even do this? Well, we have to start with your lifestyle. But what the hell does that actually mean? They always say lifestyle, but what does that mean for you? Lifestyle is how you're living on a day-to-day basis. Okay? So are you getting up in the morning and going straight to caffeine? Are you getting up and going straight to your phone? These is a part of your lifestyle that's actually hurting you. Okay, so we need to look at lifestyle. So first of all, we need to be making sure that we're getting enough sleep, and if you're dealing with, you can't get enough sleep because you're dealing with an underlying health issue, I get it. You got to start there though. You got to start somewhere. Get adequate water in, get steps in, get sunlight, as I'm making this in a fluorescent light, but we'll get it later. But get sunlight. Okay. Next is your nutrition. I can't even emphasize, and nutrition is so nuanced because, if you're dealing with a gut issue, then you'd want to tailor your nutrition differently. If you're dealing with a hormone imbalance, you want to, and going back to what I'm saying, if you're running a detoxification protocol, you want to, so like I'm saying, it's all individualized to you. You have to do it individualized to you. But some general guideline is to remove cereal grains and gluten. Next is remove other food allergens like dairy, corn, soy, omega-6 seed oils, okay, added sugars, artificial sweeteners, food additives, emulsifiers, and all these things disrupt your hormones, your gut, and all other systems within your body. Next is to get adequate exercise in. Now, most people actually, it's actually a pretty nuanced topic as well, because it's either people are overtraining and overstressing and actually undereating. So that's how they got actually to that physiological damage part where they're in a catabolic state, or they're just, not eating at all, or they're eating too much. Okay. So you have to find a fine line. You have to get into, where you're eating enough calories, you have the right enough nutrients in, and you're getting the adequate exercise in. I'd say resistance training is top tier for exercise. Walking is up there, but and I believe in running as well, not chronically, but if you're a triathlete, maybe. But if just for performance aspects, and so we have to look at all these things through a root cause approach, a functional lens, and this gives in a topic of detoxification. So in our environment today, we have to run detoxification protocols. It's inevitable. And it's because the environment we live in, through the products that we use, the food that we eat, the air that we breathe, the houses we live in, the clothes we decide to wear, even clothes, all contain heavy metals, toxins, mycotoxins, and this is all clinical data that's been shown. And all this does is rip us from our vitality. And so that's why detoxification is more than ever important. And this is why it's the first step inside my program. We do a specific detoxification protocol, and then we work into the specific issues that you're having. This is why we get results, because we do that, and then we get you the body you want. Okay, so start with detoxification first. Low toxic living, it's real. We need to do it. But I just want to hop on here and talk about a broad functional nutrition. Actionable advice for you to take away with is to watch the products that you use, low toxic. Next is to clean up the diet, make sure it's anti-inflammatory food. Remove the negative things, artificial sweeteners, added sugars, food preservatives, okay, gluten, wheat. Dairy is fine for the most part. Okay, remove those. Third is to get adequate exercise in. Resistance train 2 to 3 to 4 times a week. And supplementation I can't really talk about on here because it's very individualized. I don't want you to go in and get a bunch of random supplements because I care about. And get sleep and hydration. So if you're looking to actually get to the root cause, heal your body from within, and finally live the life that you want and deserve, then I am for you. If you're looking to optimize your health, get actual lab testing done that actually gets to the root cause. Get a nutritional protocol tailored to you that's guaranteed for you to increase your energy, increase your sex drive, boost muscle mass, lose body fat, and increase vitality, then I am for you. Once again, my name is Diego Reyes, functional health coach, functional nutritionist, owner of Complete Vitality, functional health coaching. We are a functional health coaching organization that helps men and women just like you heal their body from the inside out, make them look good and feel good. Appreciate your time. Thank you.